Hello again, it's this weekly's instalment of the discussion I have in reference to cosmetic surgery and just relevant points. Today we're going to chat about breastfeeding and breasts. Now there's two issues here. The first is when you have a baby and you breastfeed, what that does to your breasts. Well, breasts will in time just come down. It's the nature of the beast. And also breastfeeding will cause trauma because the breast will swell with milk and the baby in suckling will actually cause physical suction. Now, one of the advice I give to all the women is that if you're going to conceive and have a child, you'll need to support your breasts a lot more. So really consider double bras support. If the breasts grow bigger and they don't come down too much, you've got a chance they'll stay in position. When you are actually breastfeeding, I would suggest that what you do is try very, very hard to balance the baby's needs from left to right. Because if you don't, and I see this all the time, one breast can significantly change in size if you breastfeed on that breast more than the other. Now, will you be able to, again, continue to have children after breast implants? That's the other question I get asked multiple times. Well, my belief is, and I've seen it many times, that implants by themselves won't necessarily disrupt your ability to breastfeed. So it's not a real issue if you go above muscle or below muscle or the silicone or the salates. It's a matter of size. If you think about it, it's a gland. Now if you put a pressure behind the gland and you squeeze the gland up, it's going to have a harder chance of producing milk. So if you have an average size implant of 250 to 350, usually it should be okay. If you're starting getting bigger, 400, 500, 600, you may have difficulties. Now there are a percentage of women who cannot breastfeed anyway. So if you're one of those women and you haven't had a child to test it, then you have implants, you may well then not be able to breastfeed anyway. The procedure of a lift is taking an incision around the nipple, raising the nipple to an area you've made available for it higher on the chest. Now you're not actually disrupting the gland or the blood supply underneath, but you will probably change some sensation, and it's a higher chance that you may cause some disruption to the breastfeeding after the lift procedure. So this is just a little quick bit of information giving some knowledge about breastfeeding. Hope it's helpful, and we'll catch you later.